So my name is Maggie. I'm a paediatric clinical research nurse. I work as part of a network. So we have, in every main hospital in Scotland, we have a paediatric clinical research nurse who helps with clinical research in children and young people. So my job is really working closely with the doctors that are leading the care of families in paediatric services. And we would be introduced to the families through the doctor that's looking after their child. And then we would explain what was involved with the research study, what it involves for them and their young person. And then we would, if they were happy, after lots of discussions, if the child was happy and the parent was happy, we would arrange to see them for the appointment to go through the research study where they could start taking part. So some studies involve seeing families on a really regular basis, face-to-face. So we might see them every 3 months for a year or 2 years. And some studies might involve just one face-to-face visit and then phone calls to see how they're getting on for maybe just 2 phone calls. They're all very different. And our job is really to be a point of contact for the families, following them up through the research study until the end of the study. Job is really varied because we have research studies in lots of different areas in the Children's Hospital. So we have research nurses who work in children's cancer, who work in neurology, orthopedics. We have renal studies in the past. We've had studies that are looking at what is best for children that are having general anaesthetics. So every day is different. So at present, we're working hard to answer questions to improve the health of children in lots of different ways, in lots of different areas. So some of our doctors who look after broken bones are looking to see the best way to treat certain wrist and elbow breaks. Is it better to have a cast put on only, or is it better to have it fixed with pins, etc. in theatre? Some of our other doctors that look after children with gut problems are asking questions and looking at poo and blood samples to see if we can reduce the inflammation of the gut in children who have Crohn's disease. And then we've got some doctors who look after the babies that come in with bad coughs and wheezes and have to stay in hospital. We're looking to see if we can give them a special medicine that is an immune booster, to see if it can stop them going on to have a wheeze as they get older. And then we have other doctors who look after children who have epilepsy and struggle with their sleep. And we're helping to see if playing some special games and using a specific program can help them with their sleep problems as time goes on. So because we're part of a network and we have children's research nurses in all main hospitals in Scotland, it means that we can do different studies in different areas. So for example, we can have some very intensive studies looking at very specific specialised rare conditions. And one of those conditions is Dravet syndrome. And we have seen that a new medicine is being used now in children that have Dravet syndrome that wouldn't have been available to them before, and that has really been life-changing. We've also been involved with studies for children who have cystic fibrosis. So there was a group of families who took part in a study that was looking at a new medicine, over the past few years. And that has meant that that new medicine is now part of their standard care, and it is given much earlier than it would have been before. And this obviously has helped children with cystic fibrosis to live longer and better. In oncology, there's been a huge change in the way that children are treated, really because the studies have been going on for so long, and that has a huge impact on the survival rate for children that have different oncology conditions. Blue skies thinking really, I would love to see every child who attends a doctor or visits the hospital have the best treatment for them. And that can only really happen when we have the evidence that something new works better or something that we're currently doing doesn't work. So we need families really taking part in research today for the future of our children tomorrow to make sure that the treatments they are having are safe and effective.